Scoliosis is an entity that can happen to young people or older people. Some people are just developed that way in their spines, and it results in curvature of the spine, that it can be sideways or to the front of the spine. Some people actually result from aging changes of the spine. It's that when we talk about tear and wear changes of the disc and the bones in the spine, and both of them can result in quite a bit of disabilities. So the most common symptom is always going to be pain. Most of these patients complain of very disabling pain that affects their quality or capacity to perform activities of daily living. Less likely, but also oftenly seen, is change in their posture, kind of a cosmetic appearance. And they can also have difficulty with eating, breathing, common things from the posture of their upper body. You should seek medical attention when the pain in your back has become disabling and affecting your everyday activity. If you notice other signs like pain down your extremities, your legs, or numbness or tingling, you also need to seek medical attention. When treating scoliosis, you can start with the basics, conservative measures like physical therapy. You can do core strengthening exercises. You can try pain management that can include things like medications or injections of your back. When all those measures fail and you still remain with severe disabling pain, the next line of treatment is surgical deformity correction surgery. Nowadays, we have newer technology that we call kind of GPS navigation, that I can actually have a computer guide the placement of the screws. And even more recently, Orlando Health had been at the elite point of advancement with robotics, that actually is a robotic arm with GPS navigation guiding the implantation of these screws into the spine very safely. The recovery for these surgeries has improved quite a bit, and I think the key factor is doing a multidisciplinary approach, and that's something we have at Orlando Health, is involving early a very strong physical therapy team to facilitate the therapy and the recovery of the patient, having available a pain management group that will help to control the pain adequately, and also having, of course, the technology to make this surgery safer. So we certainly have a better outcome than what we used to have a decade ago. A Center of Excellence for Spine is a badge of honor we recently acquired at Orlando Health. We have one of our sister hospitals, Health Central, already been at that level as well, and there's only one more hospital in Central Florida that can claim that certification. Is the Joint Commission, and it certifies that we consistently provide the highest standard of care for our spine patients at Orlando Regional Medical Center. The good news for people who have scoliosis is you don't have to keep suffering. There's a solution for you. It often involves surgery, but it can be done safely and predictable with the technology we have available, and we can get you from a very disabling life to a good quality of life where you can have good functional outcomes.